Laura, hi.
I,
So we're here to talk about mindfulness in your practice, and I have some questions for you. And it's just great to be in conversation with you about how you're experiencing mindfulness in your practice. And you and I have known each other for a long time. Uh, Back when you were a trainee at Cambridge Hospital, and I was there on the staff in the psychiatric department, and I think we were both relatively new to mindfulness back in the old days, and a lot has happened. So I'm really curious about um, how things have evolved for you. So I'll start with first question is so your most of your professional life has continued to be in a hospital setting, and I wonder, like, how have you been bringing mindfulness into that setting?
yeah, I've been really fortunate to work in a variety of hospital settings over the last 15 years. And maybe I'll just mention what they are to give some context, because I think a lot of what I have to share, at least today, is kind of targeted for people who are working in hospital settings or within the medical model and maybe wanting to incorporate mindfulness more into their practice, but are feeling maybe like the paradigm they're working in doesn't necessarily support mindfulness. So I have a lot of thoughts about that. And I've worked in a community-based setting for most of my career over the last 15 years, mostly a public safety net hospital, Cambridge Hospital, Cambridge Health Alliance. And I've served a variety of roles since I'm a psychiatrist, from being a consultant in a primary care office where many of the patients I would see or clients weren't actually expecting to see me. So primary care doctors would need some help and they would identify a mental health concern, and then suddenly a client would be meeting with me without having expected it. So I'll speak a little bit to how to work with that population who's really not even expecting to encounter mental health, and how to introduce mindfulness concepts. And then I've had the good fortune of teaching mindfulness more explicitly through mindfulness-based cognitive therapy groups at the Center for Mindfulness and Compassion, which I was part of helping start about 5 years ago now. I've also taught mindfulness to people in training, a lot of doctors and psychiatrists in training who are very high risk for burning out, and so have some experience in that realm. And then for 8 years, I worked in a general outpatient psychiatry clinic. Often patients were being referred to me, since I'm a psychiatrist and can prescribe medications, with some preconceived notions that sometimes they had been told, or they had an idea in their mind that I would have a magic medicine for them that would just kind of magically make their suffering go away. So a lot of my practice around mindfulness has come out of those sort of lived settings. And I want to focus today on the topic of patients or clients who are ambivalent about and really struggle. It's difficult to engage in mindfulness directly. So these would not be people taking a mindfulness course, really at a different stage. And I think this applies really to the common experience of any clinician seeing a broad base of patients, especially in a hospital setting, but I think also in private practice as well. And often these are patients with extreme suffering, just extreme amounts of suffering. And of course, I wish that I had a magic bullet. I think we all do. And I always joke that, if I did, you'll be the first that I'll tell. I'll let you know, and then we can have a line out the door, because I think many people would like a magic bullet. But I think certainly I have learned, and from knowing you, Doug, I imagine you would agree that healing is just not that simple, and sometimes the path of healing is what we least expect. And I think it's a really challenging situation to be in as a clinician, because of course there's a certain amount of pressure that you can feel when someone comes with an expectation that you're going to fix them. And we as clinicians, especially in hospital settings, we're immersed in the medical model, and it's very tempting to latch on to this fixing paradigm,
Yes.
and to sort of offer mindfulness as a prescription to, eliminate symptoms. And while I think that prescribing mindfulness is useful in some settings, I think I don't disagree with that, but it's the timing and how it's introduced and the context, they make all the difference. And it's
Mm.
very tempting in a sort of fast-paced fix-it model just to say, well, have you tried mindfulness? Go try mindfulness. And I've found that that just doesn't work, and it often backfires, and it misses an opportunity to bring some of the value of the principles of mindfulness into the treatment setting, which is such a shame. And you know, it's understandable that as clinicians we would be pulled into to do this. You know, we're existing in an American culture of quick fixes, and so we exist within this collective. And you know, especially in this moment of, I would say, recent collective trauma with the impact of the COVID-19 pandemic, you know, social upheaval, exacerbation of racial, social, health inequalities in our
Mm.
society and our world, it's critical for us to hold space for a collective pause to really discern skillful action. And the treatment setting is no different. In the same way, approaching the individual with a pause first before jumping to treat is its own way of bringing mindfulness right into the room for ourselves and our clients. It's not
Mm.
using the word mindfulness, but it's really embodying this principle of pausing before discerning skillful action.
Oh.
So those are some thoughts about kind of how the hospital setting in particular and the medical model has shaped some of my
Yeah.
experiences.
Oh, that's fantastic. And you said so much there that I'll look forward to us talking at greater length where we can go into more depth. Um, so, you know, it reminds me that, and I think that's what you were just referring to, that you've in our previous talks, you've mentioned implicit mindfulness. And can you say a little more about that? Is that an example of it when you're talking about just like simply pausing can be a way to become mindful? Is that an example of implicit mindfulness?
It is, and you know, that term is just a term that I use, but I think it could just as well be called mindfulness informed treatment, or you know, an embodiment of mindfulness principles in the room. And in my own trajectory with mindfulness, I've moved as I've incorporated mindfulness for myself into my way of being more. I have found myself talking about it less and just trying to do it more, trying to be mindfulness rather than to talk mindfulness, to walk the walk in addition to talking the talk. And of course, when I'm in a more uh, place of feeling pressure to fix something and I get into my doing place, then I slip up and I have to take my own pause. So it's not a seamless, it's a constant, ongoing process. But yes, so the term implicit mindfulness is just a term that I use really to describe this idea of embodying mindfulness principles, and that alone is actually a way of bringing mindfulness into clinical practice. You know, many times people in training say, I want to do more mindfulness with my clients. And, you know, my viewpoint is you can do it by embodying it, and you don't even have to use the word. And that's probably a much more powerful for you and powerful for the client, because you're more attentive to your own experience. And as we all know, burnout and the healthcare system itself is on fire, not just with the pandemic, but it's a very fast-paced and the place to work, and it's challenging to really embody mindfulness in that setting. So just to name that feels really important. And there's the stages of change. I don't know if you remember in kind of working with people in addictions, there's this stages of change model.
Yeah.
Prochaska and DiClemente have this, and it's really about behavior change. And it's the idea is that it's a continuum that happens in stages. We talk about pre-contemplative, contemplative, and you know, while it's used often with addiction, I think it's helpful if there's any kind of habit that we want to try to bring in more into a particular setting in our lives, in working in hospital settings, to sort of consider that there are stages. It's not something that just happens overnight. And similarly, there's a stages of readiness that different people have, depending on the paradigm that they're working within when they seek treatment. And what treatment is, what that means to them, what they think treatment will look like, and really any readiness that they might have to engage in explicit mindfulness is all up for grabs and needs to be assessed at the beginning before just jumping in. And I think especially for clinicians working with clients from a variety of cultural and socioeconomic backgrounds, you can assume, you should assume that patients are going to have their own associations culturally and otherwise with the word mindfulness. And, associations can run from it being something that just white people do, or, that people who are really into yoga do, or that it's somehow means that you're betraying your faith. If it has roots in Buddhism and Buddhist psychology, that, you'd be betraying your faith if you were to do something like this. Be very culturally unfamiliar. People's families and sort of upbringings around how to work with emotions can have very strong paradigms that are quite counter to mindfulness. And the idea that it represents a sort of a panacea or a quick fix, it's been branded and commercialized a lot in our society as this sort of panacea, and that's not actually what it is. I also think we're living in a time of such divisiveness right now that it's even more important than ever to find ways to share the principles and the concepts of mindfulness that really take the audience into account, that don't end up dividing or creating any kind of divisiveness unintentionally, of course. So those are some thoughts about barriers that can get in the way of a client being able to engage with mindfulness, and just being aware of those can make a huge difference.
Wonderful. Yeah, thank you. That's beautifully said, and there's so much in there, and I can hear how passionate you are and dedicated to experiencing mindfulness both personally and professionally, and bringing it to the patients that you work with. So I look forward to talking in more depth about this. So thanks for being here today. We'll talk further.
Sounds good. Thank you, Doug. Really great to connect with you.
Same here.
All right. Bye-bye.
Bye now.